Hi, welcome to Oral Pathology NEET sessions. We are discussing about the disorders of blood. In this video, we will be discussing about a small topic that is our hemophilia. Okay, hemophilia. So hemophilia is a very small topic, and you can expect 1 to 2 questions in your NEET and your competitive examinations from hemophilia. Hemophilia is a good area for picking up competitive level questions. So hemophilia actually it is a hereditary disorder. It is a hereditary disorder, and that is affecting the clotting factors of your blood. Okay, so what are the clotting factors it is affecting? So it is actually a hereditary disorder affecting the clotting factors. It is a X-linked recessive disorder. So X-linked recessive disorder means that the females will be usually carriers and the males will be the one mostly affected, because in male there is only a single X and single Y chromosome. So if the single X chromosome is a defective chromosome, then it starts manifesting. But in females, if it is a single X a defective chromosome, the normal X chromosome will compensate the action, and they will be there won't be any manifestation, and they will act as a carriers. Okay, so that's what actually mean by this X-linked recessive disorder. Now it usually affects the males, and females will be having carrier. So here you can see that if is a female, she is a carrier of this hemophilia, that is XH. She is a carrier of the hemophilia, and she is marrying a normal person, guy here. So what are the combinations here you can get? So they can have a XX XH child here. So there is a single, this chromosome and this chromosome comes in one child. This XH and Y can come here. There is XX and XY. So here what you can see is that these two child is a female child normal, and this is a male who is normal. Okay, and here you can see that the female child, she is having one defective chromosome here, but the normal X chromosome will compensate it, and she is a carrier female. There is no manifestations. But for this guy here, the poor guy here, he has this defective X chromosome came, and there is no other X chromosome to compensate for this, so he will be having the manifestation. So he is the affected male here. Okay, this is how the transmission of this hemophilia occurs in generation to generation. Now there is types of hemophilia: hemophilia A, hemophilia B. Okay, in hemophilia A, what you see that there is a defect in the factor 8. Factor 8, the clotting factor 8 is the one defective, that is hemophilia, or is a classical hemophilia. And about B, hemophilia B, it is factor 9. Okay, that is called a Christmas disease. Okay, Christmas disease. So hemophilia A is a defect of the factor 8, and hemophilia B is a defect of the factor 9. Is called your Christmas disease. Now, what are the clinical features of this hemophilia? The clinical features of hemophilia depend upon how much the factor is present in the body. How much normal factor is present? Yeah, the symptoms will be mild if we have a factor greater than 5%. If the level of the factors is greater than 5%, then it is usually a mild one. So in the normal condition, okay, the normal condition, what is the hemostatic level? That is, we should have a more than 30 to 40% of factor 8 is required. Okay, more than 32%, 42% factor 8 is required for a normal hemostasis. Now if it is greater than 5%, at least, then we are seeing only 5%, mild hemophilia, and if it is 1 to 5%, it is moderate, and if it is less than 1%, then we have a severe hemophilia. Okay, we have severe hemophilia. So what are the manifestations? Early signs. What is the early sign? Is that the patient will be having a bruising in the mucosa. Okay, mucosa. There is a mucosal bruising. There is bleeding tendency. There is hemarthrosis. Hemarthrosis means most commonly the ankle joints are affected. Your ankle joints, or weight bearing joints, where you bear your whole body weight. There will be, when you are walking, there is friction in the joints, and that even the friction can cause bleeding in the joints, and we can see a swollen warm joint in the body, that is due to blood being full in the articular spaces. Okay, so that is called a hemarthrosis. Okay, hemarthrosis mainly in the ankle joints. You can feel a warm tingling sensation in the joint. The patient will be feeling a warm tingling sensation in the joint because of the bleeding within the joint. And what are the other thing you can see in the hemophilia patient? If you take the lab findings, okay, in the lab findings, what you can see, if you take there is an increased APTT. Okay, why I have told you the increased APTT? Because the factor 8, I have told you the factor 8 is the one which is controlling the intrinsic pathway. In your blood clotting, you have your blood clotting have your intrinsic and extrinsic pathway, intrinsic and your extrinsic pathway. So the intrinsic pathway is controlled by your factor 8. Okay, what are the things controlling the intrinsic pathway? Okay, the factor 8, 9, 11 and 12. Okay, that we will see. So this in hemophilia there is an increased APTT. Okay, and what are the other treatment? How you treat this hemophilia patient? You can give factor 8 injections. Okay, injections can be given, and you can give other drugs like desmopressin. So desmopressin is a drug which will release the factor 8. Factor 8 which is stored in the body, or which is present in the body, it will desmopressin will help in the release of bound factor 8s and cause there is an increase in the level of factor 8 in the blood. So desmopressins can be used. Now if you see the clotting disorders, okay, I will give you a clue about this clotting test or disorders. What are the different tests in the clotting disorders? You take bleeding time. You take the bleeding time. You can see the bleeding time, it depends upon the vessel and the platelet. So it depend on blood vessel as well as the platelets. Okay, so what are the things which are affecting these blood vessels or the platelets? There is an increased bleeding time. So you have your von Willebrand factor defect. Okay, if you have a thrombocytopenia, your thrombocytopathies, you are having aspirin. So all these cases you have an increased bleeding time, because these are the things which affect the platelet aggregation. There is a defect in the platelet aggregation or platelet adhesion. There's a defect in the platelet number, or there's a defect in the von Willebrand factor which will help in the platelet adhesion, or the patient is having aspirin which will prevent the platelet aggregation. So in these cases you have increased bleeding time, or you have a collagen disease, a collagen vascular disease. It will affect your blood vessels. Okay, in such cases you have increased bleeding time. Now coming to the clotting time, what are the things affect your clotting time? Your clotting factors, any of your clotting factors, if it is defective, or the vitamin K or the calcium. So if there is any defect in this, there is an increased clotting time. If there is any defect in your clotting factors, a defect in your vitamin K, your calcium, we have an increased clotting time. Now coming to prothrombin time. Now prothrombin time is a time which measure the extrinsic pathway. Okay, it measure the extrinsic pathway, and the extrinsic pathway is controlled by two factors, that is your 3 and 7. The extrinsic pathway is controlled by the factor 3 and factor 7. So if there is any problem in this extrinsic pathway, or any problem in this factor 3 and factor 7, there is an increased prothrombin time. Okay, so that is mainly in prothrombin time. Now coming to the APTT. Now APTT measures intrinsic pathway. Okay, so APTT, that measuring the intrinsic pathway. What are the factors in APTT? So prothrombin time PT, there is two letters, two factors, 3 and 7. In APTT 4 letters, 4 factors, your 8, 9, 11 and 12. Okay, so that is about your APTT, and if there is any problem with this, there is increased APTT. Also you should know that the von Willebrand factor which is a carrier protein for this 8. So if there is a von Willebrand factor problem, also there is an increased APTT. Okay, why? Because that will act as a carrier protein for factor 8. The factor 8 is normal there, but von Willebrand factor is acting as a carrier protein for this what APTT. So if there is any defect in the von Willebrand factor, that will reflect in the problem with of 8, and there is an increase in APTT, and APTT is used to measure heparin activity. Okay. Heparin activity. The heparin activity is measured by APTT. Okay, so these are the certain facts. There's a lot of question you can answer from these concise nutshells. Okay, so we are giving you this in a nutshell so that you will be easy to answer many questions regarding the bleeding and clotting factors. Okay, hope you enjoyed the class. We'll see you in the next class with another topic. Thank you.